good, bad, or indifferent, you should always expect your CFO to be honest with you and deliver you the news.
Carrie, do we have a quorum?
I'm not even sure we have a quorum.
Just a quick announcement. Kathy's not feeling well, so she's not going to be here tonight, and Mary is on Zoom.
I seen that beachfront.
Oh no, I saw the beachfront behind her too, but I think she's really at home.
I didn't know the ocean was that close.
Okay, so Carrie, are you willing to lead the pledge, and then would you pray for us to start?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Bow your heads. Lord Jesus, we thank you again for this day that we have. We thank you so much for all that we receive. We thank you for this moisture we're receiving right now. We ask that you be with our time this evening as we meet for this hospital, and ask that you give us wisdom and strength and guidance. And also we thank you so much for what is this hospital we have in this community, for this community we have, and for those that serve it. In your name we pray, our Lord Jesus Christ. Amen.
Amen. Do we have any visitor comments? Looks like we have a all. Oh. In there. Okay, so no visitor comments. Do we have any? How about approving the minutes? Have we all seen them? Yes.
Madam Chair, I may have, but I do not believe it was me that went into executive session.
So I looked at my notes and I wasn't quite sure. I watched the video and I couldn't tell, and Denise watched the video and he couldn't tell either. So
Somebody else wants to fess up to that.
I can't remember what I did yesterday, let alone a month ago.
If that's what everybody
I don't remember.
wants to run with, I run with that, but
As far as you know, you don't think you do.
Did the people that reviewed the video, were they able to narrow things down to one or two candidates? Not even that.
yeah, it was really like that one section of the video was kind of overrun, and
I think it was me. And the reason I say that is because when I read this thing,
yes.
I remember you correcting me and saying, is it 405A2 or something like that? So I think it was me.
Okay. Thank you, Dottie.
thank you, Dottie.
I apologize to the board.
Go ahead.
A minor point on page 2, item 5 under Kathy Harshberger. In the middle line there, it ought to read, does respect look like, not looks like. Item 5.
Yeah.
Look. Did you catch
What
that?
does respect look like?
Yeah,
you're right.
It says
Thank you.
5. It says, what does respect look like?
Okay.
Any other additions or changes to the minutes?
Not bad for a novice.
I have a question which, doesn't have to be answered now about the minutes, but, and maybe council will have an opinion to take later, but do we really need to write out what the statute says every time we, unless the statute, if memory serves, the statute itself says quoting the statutory section is sufficient.
Okay, well, we will ask Al. She's driving right now, so she's listening, but it's on.
Well, I'm in no rush. I just thought we don't need to do it. Why are we doing it?
Right.
Yeah, I know Allison's always told us to, but in other parts of the county, they don't. So,
And that's good, I think, because statute says, just quote the statute said.
The section and
Okay, anything else as far as, the minutes go?
Oh, Allison may be smarter than me by far, so. Probably has a reason.
Okay, so do we have, did somebody want to move to accept them with the changes?
Madam Chairman, I move that we accept the minutes with the changes.
Second,
Are you kind of keeping track of stuff, Carrie?
yeah, in case I have to write them again, I will do that.
I know, I was really, okay, back. So all those in favor of approving the minutes, say aye.
aye.
All those opposed, same? Okay. So when I was on there the other day on Zoom, it was amazing how well I could hear you guys whispers.
And
Yeah, just,
I am trying to keep minutes also, so as we
okay.
go.
Okay, thank you, Mary.
We
Sure.
better be careful while we're whispering. Is that what you're saying?
I heard whispers.
The
So I
good
can
thing
move
is
on.
it's better than it was, because
It's
for a
not
while,
much
the
better than
video
it
was
was.
pretty bad.
Yeah.
New speakers, Wendy got us new speakers and, yeah.
That's good to know. Thank you.
Okay, now for the agenda. Do we have any additions or changes to the agenda? I do have a change. I had said that we're gonna defer the bylaws discussion because I have dropped the ball, but, I don't. I want to talk about it a little bit, so.
So remove the defer.
Yeah, remove the defer.
What item are we moving?
On the bylaws discussion, I had said defer.
Bylaws.
I had dropped the ball, but we better talk about.
And then are you taking out this meal report?
Are you,
Yeah, I
I
have a
think
few
Paul's
comments on
able
that.
to,
Okay.
Paul will do some stuff on that.
I would make, when we get to it, one comment on the bylaws.
Yes. Yes, that would be good.
Okay.
Okay, any other changes or additions to the agenda? Would somebody need to approve the agenda?
Move that we approve the agenda with that one change, yes.
And do we have a second?
A second.
Okay, all those in favor of approving the agenda, say aye.
Aye.
All those opposed, same. Okay, so, can you hear us, Allison?
She's muted though.
Yeah.
Yeah, I can hear you fine.
Okay, good. So do you want to talk a little bit about appointing the new law firm, or do you want me to?
I'm happy to. So starting in January of this year, I have joined a new law firm. It's Yonke and Toner, and I've opened a Gillette office for them. And so that's the reason for having this on the agenda, is to update the agreement with the new firm of Yonke and Toner from Love Now Law.
Okay, thank you, Allison.
Thanks.
Is there,
Madam Chair, I enthusiastically make the motion that we appoint Allison P. of Yonke and Toner as our law firm.
okay, is there a second?
I'll second.
Okay, do we have any discussion? Go ahead.
Before we approve it, are we gonna see the terms?
They are the same terms that were under the prior agreement.
Those are the same terms I'm unaware of.
I bill my time hourly at the rate of $250 an hour, which is a significant discount from what I charge everyone else.
Say no more. Thank you.
Thanks.
Thank you. Any other discussion? All those in favor of switching the
Contracting with Yankee and
Yeah.
Toner.
Yes, all those in favor of contract with Yankee and Toner for Allison's lawyer services, say aye.
Aye.
All those opposed, same. Okay. So we've
Who
got
made that motion? Okay, who seconded it?
Ben. Okay, Polly, do you want to give us a quality report?
Absolutely. So for my board report, I've kind of broke it out into some different things. So I'm going to start with infection prevention first. As of January 1st, 2026, the facility's influenza vaccination rate holds steady at 74%. This represents a decrease from last year's total of 79%. The COVID vaccination rate remains low at 4.2% this year, which is consistent with rates observed during the previous year. And influenza and COVID numbers remain seasonably low at the moment, with a considerable spike in cluster in strep A infections coming out of the clinic, as well as the influenza A. A is what is predominantly seen thus far, and that has actually spiked in the last week pretty significantly. Long-term care infections increased in the calendar year 2025 to 74 infections, up 12 from calendar year 2024 that saw a total infections of 62. Contributing factors include higher census, staff turnover, contract staffing, inadequate education for nursing staff by infection control, short staffing, and resident refusal of care. PI projects and education will be built around this overall increase. No outbreaks reported in acute care or long-term care at this time. So under safety, workers' compensation claims ended the year at 2025 with a total of 13 claims reported compared to 8 claims total in calendar year 2024. Our lost time from work days decreased significantly by a total of 143 days when compared to calendar year 2024, which is good. That's a good significant decrease. We like that going in that direction. And then, as we all know, violence against healthcare workers is becoming more predominant in the headlines. And even though we are in a rural area, Weston County Health Services is no stranger to violence among our healthcare workers. Recently, we've had several instances of situations that have resulted in physical force by our police officers, tasing, and apprehensions. I will begin the process of tracking incidents of aggression, including verbal threats and abuse, and physical threats and abuse, as well as including instances of near misses, with those seeking to escalate their situations. This data will be brought forth in our monthly safety meetings, quality meetings, as well as being shared with board of trustees in my monthly report. On the quality front, Group A of the Quality Committee met with following our departmental reports and progress of performance improvement projects. For acute care, Donalda reports on improvement of discharge vital signs and oxygen documentation in Epic with her staff. Radiology updated their work with the CT project installation and possibly adding a low-dose lung screening program to their list of projects. Home Health updated the group regarding HCAP scores with the difficulty in survey response and updating the home health patients with the community emergency response plan. And Employee Health, I updated the group with the completion of my PI project aimed to reduce workers' compensation by 20% by year's end. By educating employees on such things as proper logistics and other educational topics pertaining to the nature of their specific injury, as it promotes a culture of safety, thereby decreasing the number of injuries. It ensures keeping our teams safe while reducing the worker comp premiums in the future. And other quality data transfers out of facility for December are 9, with 4 going by ground, ambulance, and 5 by private vehicle. Manor transfers for the month of November were 8, with 1 resulting in an out of facility admission. For ED readmits within 72 hours, there was a total of 8 patients seen twice, with 2 patients admitted inter-facility and 1 transfer out. We've seen an increase in HIPAA violations reported throughout our incident reporting system, and many were unsubstantiated, so some re-education was sent out to our employees regarding compliance in HIPAA. The med staff meeting will be held on January 27th, where we will review both November and December data due to policies.
Mary, did you want to add some more?
No, I don't think so. I was just really concerned about the increasing aggression to the healthcare workers, and Polly and everyone addressed that. So I don't have any concerns. I mean, I have concerns, but nothing to add.
I'm glad to hear that you'll be reporting on it. Keep it as.
Yes, and Donalda and Paul are gonna be involved in a lot of that too.
Madam Chair, I would like to say, I think this board has to start considering, as these things are looked at and are evaluated more, that we have to start updating security in this facility to some level. I mean, if we look at it compared to any other hospital, we have absolutely no security at all. And these incidences in the ER, 2 taser events, I believe there was, where people had to be tasered in the emergency room, and no security here at all, no doors. I mean, this is something we're going to have to address and probably start considering budgeting money to put towards at some point. So,
How, there was some talk about the doors being locked at night. Is that happening now?
There's a lockdown policy.
yeah.
Okay, so anything else on this? Anything else for Paul?
We're ready?
Yep.
Alrighty, so our current census over at the manor is 52, which puts our occupancy rate at 89%. Our payer mix, we've got 31 Medicaid, 7 Medicaid pending, 12 private pay, and 2 VA. We had 1 admission in December and no discharges. However, we did just have a recent discharge that I'd like to discuss a little bit further in executive session. Current agency staff, we have 7 CNAs and 2 nurses, with 2 additional nurses coming, I've been told. Recent hires, 7 CNAs right now for contract.
Okay.
So our plan is to not replace them as we get more of our own employees in. So we are going to be working, there's a current CNA class going on through the EWC. I believe there's 7 students in there right now. So we're gonna try our hardest to recruit them to come work for us. So hopefully we will see that CNA number decrease as well. And then for the nurses, we have 2 right now, with 2 coming. And we did get one of our contract nurses. She would like to stay on and work PRN for us as our own employee, not as a class. And we did get one of our contract nurses. She would like to stay on and work PRN for us as our own employee, not as a class.
Nice.
Recent hires, we did hire a food and beverage director. We sent an offer on Monday. He's in the background pending process right now. So hopefully, pending his background and drug screen.
Where's it from?
He is currently in Jackson, Wyoming. He was there at one of the resorts. The idea behind the food and beverage director is that we can get an executive level chef to come in. He is an executive chef. Get an executive level chef to come into our kitchen, help train the cooks on how to get more professional level of cleaning, and then get the kitchen running how a kitchen should be. So I'm really excited to see the potential. And with him being executive chef, just to see the quality of food that the residents are going to get, I'm really excited for that as well because they deserve it. We still have our 1 complex resident that we talked about before. We're still working on placement for him. And then our state survey, because we did receive a G tag with our resident to resident abuse, Medicaid has put our admissions on hold for Medicaid patients, residents. So our Medicaid residents that we've currently got in-house, it doesn't affect them. However, if we were to admit a Medicaid resident now, we wouldn't get reimbursed until the state cleared that tag. So as of right now, our plan of correction is pending with the state. I don't know when they're going to approve it, but it's all been submitted by the deadline. We just need to review it and approve it because we did get a G level tag that will require a revisit from them. So the state will come back in, review everything, and tell us we're good to go. I do have a state binder where all of our performance improvements based on this plan of correction is in. So when the state comes back in, I'll just hand them this binder and say, here's all of our corrective actions that we've done, our continued monitoring, all of the good things. Our life safety tags that we got, they accepted our plan of correction, and so that's all good. Our life safety, we got tagged on our Christmas trees not being non-flammable, so that's an easy fix, thankfully. And then a couple places where the manor doors, there's a couple of manor doors where some computer wires were ran up in the ceiling. They didn't have a fire barrier like caulking around them, so it didn't create a smoke barrier. And so that's also since been fixed. So just minor little things that are easy fixes. Thankfully, we've got that all fixed. And so we're just kind of sitting and waiting for state to clear us and come back for the revisit and then send them on their way for 15 more months. So yeah, that's all I've got for you tonight.
Thanks.
Any questions for Kim? Okay, Tressa, sorry about your name. One of these days we're gonna get it spelled right.
It's okay. A really good month for us. We were up from the previous month, 111 patients. We had a really good December, good team building activities. We had Secret Santas, and then we had a small dinner just amongst the clinic employees then on the 23rd, and it was really nice just to share some Christmas cheer and holiday with each other. Kelly Randerman has extended her contract through June, and so we'll have her through June 5th. And we're really excited about her. She's seen a lot of people that are coming over from the other clinic in town, which is even better. On our culture and engagement, January is National Radon Action Month. We were a little bit behind. We did reach out to the Wyoming state radon department, and they have sent us coupons. I just sent those to the printer. They are cards that we can distribute throughout our community. We're going to drop some off at the senior centers as well, that they can mail in for a free radon kit, and then they can get their results back. It just kind of just abbreviates, why radon is so important in the state of Wyoming, and especially with how we're experiencing it tonight. Our homes are closed up and they're not releasing that gas if there is some there. Our process improvement has been on revenue integrity this month, and we are doing a lot more for our pre-authorization to make sure that pre-authorization is actually placed in the correct place. So when the NOVA sees our claims, they're not having to go back in and try and find out there's a special place in the Epic EMR that we are putting that in, and so it immediately falls to the claim when it goes out. So if they are sent over for x-rays or labs or anything like that require pre-authorization, they're not having to do that. We are also starting to pull reports out of Epic for anybody that is 64 and a half and newly coming into Medicare. We're going to start to really push out and do calls and trying to get them scheduled for their Welcome to Medicare visits, because that is a once a lifetime visit. I've also been working closely with Paul's department, and we have weekly meetings set up right now with the Epic team out of Monument. So each week we have a meeting on Tuesday afternoons to try and get those older tickets done, as well as addressing any of the problems that we're finding in the EMR that these are not set up correctly. And that has been very helpful moving forward with Innova as well. As you can see in your packet, Kelly Randerman was our person of choice to go to the senior center this month, and she did a great job. From what I understand, there was close to 55 people there. We got to see a lot of blood pressure checks that we ended up sending those people to follow up with their PCP. And I included that just in case you wanted to see what she talked about. For our staff recognition, we're going to be introducing a Hall of Fame, where we're going to be putting all of our information about our staff and our providers, just so that as people are coming into our clinic, they know exactly who our providers are and our nurses. And facility safety, I'm going to do a fire drill in the next 3 weeks. So they've never had one over there. They don't even know what to do. And we've been testing our panic buttons. We have 3 panic buttons, and no one seems to understand where they go. So
have you figured out where they go?
Not yet. I'm a little nervous to push it, to be honest with you. I want to make sure that we have the police on backup just in case, and say, I'm going to push this. If it goes somewhere, don't come. But also we engaged with Jen Womack, and I think that's why we had such good turnout this time with Kelly. Mary, I'm still waiting for you to get me a contact for Upton, if you could put that on your list. And other than that, I think
I had sent a message to one of the ladies that goes to the senior center because I wasn't real sure who to contact. And she went to the board meeting and presented the information to them. And I am waiting for them to give me a name so I can give it to you.
Thank you, Mary.
Sure.
Other than that, everybody's doing really well. We're still seeing a lot of, like Polly said, a lot of strep, a lot of influenza A, but everybody's good. Happy. Yes.
I did receive some community feedback about the wellness talk, and they were very excited about it and glad that we were going to be doing more of those. Glad to hear we were going to do more. So that's pretty awesome. Thank you.
You're welcome. That's all I have.
Oh, thank you very much. Do we have any more questions?
William.
Just for the record, one more time, the correct spelling of your name is?
Trisa. No H.
Thank you.
You're welcome.
Okay. Where are we at now? Rebecca.
I am. Well, it's a little long-winded. So the HR department continues to focus on strengthening internal processes, improving workforce reliability, compliance, and supporting organizational performance initiatives. Despite recent HR staffing changes and the significant demands of recruitment and onboarding, we remain focused on sustaining operational continuity while advancing core strategic priorities. The HR assistant did successfully complete her introductory period with the organization, but I think I'm just going to summarize this so I don't read this all verbatim for you guys if you remember that. So I'm not anxious to fill that because I won't sacrifice the ability to be confidential, use tax data. So it's going to be a very methodical process. And right now we're actually pretty busy, so not a lot of time to focus on that. And it is a continuing challenge hiring in this region. So there's a slight delay in the I-9 audit. I wanted to be done with it. The foundational pieces are there. So I'm predicting the beginning of February we'll pick up. Recruitment and onboarding activities are requiring a significant amount of time of Dawn, my HR generalist. And I don't say that because I'm blaming anybody. It's just a matter of fact. Contract and travelers, it's an extensive amount of time for her, but we're continuing to push forward and we may remain committed to filling these CNA positions because obviously we want to direct hire and get rid of the increasing costs for the contract workers. So I've been partnering a lot with Paul on some internal process audits and some strategic things. We seem to align on a lot of things, and so that's made my ideas and certainly his to be a lot easier. And this I'm going to read verbatim because I sincerely mean what I'm writing here. So thorough coaching conversations with leadership and my own interpersonal interactions, I too have learned a great deal throughout this period. While day-to-day HR operations are necessary and important, the work that provides the greatest professional fulfillment to me is navigating relationships, supporting leadership growth, and providing counsel that strengthens people and processes. The senior leadership team has been focused on strengthening communication and improving our ability to work together effectively. I believe we have shared recognition that each of us brings different perspectives and experiences, and that differing viewpoints do not equate to one person being right or wrong, simply different. We have made meaningful progress in navigating challenges collaboratively, finding common ground, and building trust. Our continued efforts in these areas are expected to drive meaningful improvements in organizational performance and culture. On that note, next week, Kathy has tasked me with rolling out a leadership training session focused on respect in the workplace. This initiative is designed to reinforce professional conduct and expectations, strengthen leadership capability, and align with our service excellence standards. To enhance these efforts, we are emphasizing collaboration as a cornerstone of culture, underscoring that culture is not solely the domain of HR, but a shared top-down responsibility. Creating an environment where employees feel empowered to share ideas and perspectives requires unified leadership commitment and active engagement across all levels. So, policy review and modernization are underway. I actually did get time to knock some out with the plan to review them formally. One of those I will say that I did include here was a completely right at the corrective action policy. And I think the leadership will be happy to know that I suggested a removal of the did you know, which is childish. So, anyway, and yeah, HR continues to focus on compliance and all the other things. Thank you. Any questions?
I have a question, regarding the last paragraph in the leadership, collaboration, growth, and culture section.
Yeah.
That last paragraph references collaboration, references employees feeling empowered, I think is the verb, to come forward with suggestions or thoughts or observations. So I'm wondering why it's described as top down. Why isn't it top down and bottom up at the same time? If you're really asking them to take part.
That's a valid point. And I think you could see it both ways. I think I said top down because my focus has been so much lately on supporting, not just holding myself accountable, but sorting this team to set the example. And that's where my mind has been.
I guess I gave the wrong impression. I appreciate that, but I wasn't, my focus isn't towards why you wrote top down. It's to whether you're open to describing it. It may not be, but my question is it more accurate to describe what you're trying to do as both top down and bottom up?
Absolutely. I think that's the objective. And I see it.
Just maybe me, but to me, when I hear top down, that mean, if I'm the employee and that means I wasn't invited.
Well, they will be invited. So this is going to become part of a bigger.
So that's my suggestion, that it be described as bottom up as well. You don't have to take it. Thanks.
Absolutely. I would support what you're suggesting.
Thank you.
Is there any more questions or comments? Appreciate your work.
Oh, and I did include a new page. I do have a long-term project of actually submitting some more data, but I just didn't get time to finish that workbook. I'm going to use Paul's technical skills to help me, but I wanted to give you something.
It's nice to see that. It's nice for those numbers. Okay. Agenda. Okay, Nalda, you're up next.
I had given my board report to Denise and she said she was going to include the packet. So there is just a minor change to the census statistics at the very top. Right now we have 6 patients, 5 skilled swing head and one intermediate. And I actually have got 3 referrals from Rapid City today. So we'll look at those tomorrow and Monday. Legacy and Gillette has started admitting patients again, and Vibra in Rapid City has also been taking some of the referrals. So it gives me a little bit of stress thinking about that, but we have enough people in our community that want to come here that I think will be okay. And also with flu and other respiratory diseases start ramping up, we may see some admissions from that as well. And we've had no low census staffing days in December, or at these first few weeks in January. We had a total of 23 admissions in December. 8 were acute care, 13 were skilled swing beds, and 1 intermediate swing bed. The staff saw 150 emergency room patients, and it is 6 people at observation. There were 3 cardiac rehab patients in December.
Gordo and Gray all the way. I think it would be an epic. It's what Chuck's been picking the fight with him forever. Mark has responded a couple of times this year and gotten hot under the collar. Says he wasn't hot under the collar. I can believe it this last time that he maybe thought, you know what, I'm going to go ahead and ask him to step outside because it's what a Wyoming guy would do. I actually think it was a good play by him. I think he follows it up right now and says, hey, you know what? I think me and Chuck Gray ought to settle this like men. And so I'm going to run for the U.S. House seat.
Let's settle it on the ballot instead of the ring.
Yeah, and God bless Jenny Gordon. And I know that's a burden on families and everything if he does win. Chuck Gray is full speed ahead on it, but I want to see it, man. I want to see Gray Gordon, and I think, we'll close on that, Alexis. Let's see it. Give the people the grudge match that they've been waiting for. Give the Wyoming voters the race that they deserve.
The providers got together and made a template schedule so that the use of the locums can be reduced. Dr. Franklin wants to cut back his hours to 4 shifts a month. There's also been a new Epic AI implementation for the providers to use for their discharge or discharge summary. So they just put a little phrase in their discharge note, and it gathers all the information from the chart and puts it into a discharge note. And all they have to do is go in and tweak it, add things or take things out that they don't want and sign it. And Gordo used it today and he said it was great. He loved it. So that's a good thing. And then the nursing staff will also have some AI in Epic to use for their care planning, but that hasn't come live yet. It'll go live later this month. Travel staff for December, I had 1 CNA, and then I was able to use a PRN staff CNA to cover the shifts up until beginning next week. We're going to have a night and day shift travel CNA starting. One of my full-time night shift CNAs went PRN for nursing school. He's in nursing school, so he went PRN. So I do have those 2 travelers, but that same CNA may come work on some day shifts for me till August, depending on, she wants to rodeo. I'm not sure I can cover every weekend that she needs off. So we're working with her schedule in mind to see if we can make that work. Nursing education, we have PALS, which is Pediatric Advanced Life Support this month, taught by Tammy again. We recertify that every 4 years. So she's going to teach that. The foundation has provided the funds to us for our Babother. So we finally got to purchase that. We're all very excited to have that equipment, especially now that our respiratory season is upon us. And then I also was able to purchase another piece of equipment just through the facility. It wasn't as expensive, and it was a continuous feeding tube pump. And the reason I wanted to purchase it was I had to turn away 2 swing beds because we didn't have one. So I just thought we should have one, so that wouldn't happen again in the future. So as Polly alluded to, we've done a lot of talk lately about safety, just a ton. Every meeting we talk about safety. So it seems we've had an increase in incidents of patients verbally abusing nurses and other staff with physical threats as well. Like they said, we've had 2 or 3 patients tased. 1 was on the floor, 2 were in the ER. And police have been called to our facility more often than before. So it's getting kind of serious. Some of the safety tools we've implemented over the last few years include that Wendy put a direct line on our phones in the ER. All we have to do is hit the button and it calls the dispatch and we can have police come immediately. The other thing we do have is our e-emergency system. it's the one where we can call into, Avera, Salt Lake City. Yeah. And, anyway, and we just say Nora. Once they come on, we say Nora, or we need Nora, and that's need officer right away. So they contact dispatch for us. Our ER door is locked 24/7. Patients must ring in to come through the emergency room door. And after 9 or 10, the whole facility is locked down. There's no entrance that's unlocked. They have to be rung in. We have a product called Reflex Protect, and it's a gel spray that staff can use to spray into an attacker's face. It causes pain and can blur their vision. But we do, and then there's an antidote. So they don't have to suffer, once the danger's over, we can use the antidote and kind of help them with that burning sensation. But it gives you enough time to get away, get help. So, and then the last thing we've been discussing for safety in the facility is we're requiring everyone that enters the facility through the front door during the day to sign in. And that's a project that Tammy Dowding is going to work on. So you'll come in, sign in, get a badge that says visitor. We haven't decided exactly. We're going to have like ones that say like lab or x-ray, but they'll at least have a badge saying that they belong in the facility. So you know why they're there. And then once they're done, they can sign back out. And like I said, that's a work in progress by Tammy Dowding. And then Polly alluded to my QI projects, which I'm still tracking the discharge vital signs and then the oxygen saturations. Any questions?
What about the door at the manor? The hallways are connected through a double door there.
Mm-hmm.
Is that one going to be closed down? I could enter the manor and come through into the hospital area.
Mm-hmm. The manor locks down too. Yeah, the whole facility locks down at night.
Okay.
Yeah.
All right. Good enough. Including the double doors to the back by the garbage.
Mm-hmm.
Okay.
Yeah.
Mm-hmm. Regarding that spray, I missed the chemical name in the antidote. It's available for all staff.
Yes.
And they're trained in proper use.
They will be.
They will.
Yeah.
Okay.
We've all had training, but of course we have new staff, and we are gonna take some to the clinic now, and home health will have some, and then we'll provide training to that staff as well.
Thanks.
I have a small request for all of you. I love these reports. They're wonderful, and I love coming here and listening to all of your reports. Is it possible at all to get them to Denise maybe like Monday so that I'm not very good with reading and listening at the same time, and I really want to give you my full attention when you're listening, and I would love if I could read the report before and then bring you some more meaningful questions if I have any. That would be really helpful to me. Thank you very much. And thanks again for the reports and everything. I love them.
I have a question, and about what Ben was talking about too, about safety is, so when you talk about safety, both of you mentioned that you've had altercations with patients. Is it more patient related, or is it strangers coming through the door?
It's patients escalating. They're either here under the influence of some substance, or we did have a situation where a father came in that his son had been in an accident, and we were trying to ask him to just wait a minute until we got his son into the room and kind of not even stabilized, just in there, and and he kind of escalated the situation where we had to get Kathy even came down to talk to him because he was just so irate. But for the most part, it's patients escalating to the point of verbally.
But it has been visitors as well, you know, so it's just increasing all around.
Well, I like the fact though that you are doing the people having to check in, because I think that will help. And the spray and stuff, if you guys are, you know, being trained on that, because, you know, you're not going to know somebody's going to go ballistic till after they're in the building. I mean, something like that.
The other thing I didn't mention, we have a couple emergency rooms that when the nurse is in there checking the patient in on the computer, they are actually the patient is between them and the door. And so we're working on getting that situation fixed as well, so the nurse can go in and not have that danger of being trapped in there.
And I'm gonna call around to other facilities, other smaller facilities like Crook County and some of those around us, Custer, and kind of see what they're doing as well. You know, it's tricky because we're in a rural area. So of course, rural facilities can't afford the big city stuff. But, you know, I was gonna call around and kind of see like, what are some of those measures that they're doing to protect their staff as well. So, and I can come back next month with a report on that and let me find out. Any other comments, requests?
Okay, well, on to Paul.
Right. So this month was a good month. Start at the top here. You don't have one, if you want to follow on for you as well. Thank you. William, do you need?
I got mine. Okay, thank you.
So top line for this month here was roughly 2.5 million. That represents a roughly 15% month-over-month increase. If we look at November to December, we missed projections by this month, budgeted projections by this month by roughly 2%. It was a near miss, right? So it's unfortunate, but with the holidays, I totally understand. But next month will be better. Revenue deductions increased by roughly $1 million due to contractual obligations. And that's an increase of roughly almost 30%, 27.9% over projections. Now, quick note on these contractual adjustments. We had some turnover in the finance office in the middle of December that essentially kind of stopped the adjustments and booking of payments for that month. And then when we did a deeper dive, we actually found adjustments not being made all the way back since before September. And so we have to go back through and figure out what's going on with that and why that happened and what's missing. So that's an ongoing project between myself and Trissa and the rest of the team. But I'm feeling pretty good about it because we have a new accountant that started today, and they're going to be a staff accountant here. They are a remote employee and well-versed in accounting and finance and all of that. They've operated at the highest levels as a controller. Here, they will be a staff accountant, however, with no contact whatsoever with the actual cash movements. All cash movements are done by myself or Emma, who sits right across from me. And of course, anytime that we have a cash movement of some sort of size, we always get approval from either this body here or Kathy. So there's never cash kind of going out just unilaterally, so to speak. When we think about that, it's kind of misleading in the financial statements with respect to contractual adjustments, simply because they're understated at this point, and I know they are. And so as we continue to kind of right size the financials and clean up the mess, you'll see some fluctuations as kind of annotated in the bottom left-hand corner, but you'll see some fluctuations with respect to the contractual adjustments. If you thumb through, you don't have to do it right now, but if you thumb through to the back of this into the department level P&Ls, you'll see some departments just have zeros, right? And so that's obviously a red flag. We want to make sure that's fixed. It's going to take a little bit to unwind it and figure out exactly where the contractual adjustments have to go timeline-wise. But I'm confident that we can get that done within the month and have a really good spot going forward. So that's not going to be too big of an issue kind of next month, the month after, and so on. We had an increase in our other operating revenue by 23.9% month over month. And that's very considerable when you think about the magnitude of the increase, right? And so we want to continue to figure out exactly what's driving that increase and how we can continue to exploit that going forward and make more money on the other operating revenue.
So where do you think that's coming from?
I think a lot of it has to do with some of the special programs that we have going on here. A lot of things sometimes we're not capturing quite in Epic, and they maybe like an ancillary fee or charge that we're capturing. And so because it doesn't fit into exactly like a patient service, it'll fall into other operating revenues. So it's encouraging, but again, I want to drill down to figure out exactly what levers we can pull to make sure that we can continue that growth going forward, because I think that's a huge opportunity for the hospital. Increase in interest income of $32K. Some of that was due to the revolver that we had utilized in the month of September. I have it broken out here. So the total amount of the revolver was just over $712K. $702K was the principal that we owed on the gap payment. $10,000 was a funding fee, a one-time funding fee that we had to pay with respect to the note itself. And then $2.2K of that was the only interest amount we actually paid. So we actually netted out just over $656,000 on the remuneration of the gap payment. So it worked out well for us without impacting our cash flows and our cash on hand. So really great opportunity for the hospital. It worked super well, kind of like clockwork. And we actually have some payments coming up in a similar fashion where we will pay the government and then we will receive a larger amount in return. And so we will be using that facility, that credit facility, to execute those payments in the same vein. What's really unique about utilizing this type of financial instrument for these types of payments is that they don't necessarily tell you when you're getting the money back, the remuneration of payment. However, this past one was like within a week of the due date. So I'm forecasting that we're looking at a week of interest essentially to get the payment back. And the way the interest is calculated, for those that are nerds like me, it's on a 365-day basis instead of 360, which then artificially inflates the amount of interest you pay.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
We're actually on that 365 schedule. So for example, for us, for the $702,000 payment, it really was only $129 a day to ensure that we had normalized cash flows and we didn't go cash poor in a very short period of time. So it worked out very well for the hospital. Our bank account is doing quite well from that respect, cash basis.
And that was, you did borrow that money from the bank here in town, correct?
Yes, ma'am. First Northern Bank, and our banker is Todd, and he is absolutely excellent. We actually have a meeting March 4th. We're going to get together. So I want to meet with the banker kind of on a quarterly basis to provide him updates on our financials, regardless of whether or not he watches these meetings. But I think it's important that we have a very close relationship and he understands where we're at financially and what our intentions are to use his credit facility. And quite honestly, right now, that credit facility is only used for these gap payments. And we're not using it to pay AP or anything like that. So we're not robbing Peter to pay Paul and then accruing interest on Peter's amount. So we're not doing any of that. It's really a quick turn for us, and that keeps the interest low. And we won't have to pay this $10K funding fee ever again to use the facility. So we have it for even another 5 months till June, and then renew. And then we actually can get a larger credit facility. Not that I think we might need it right now, but if we ever need like improvement projects or things of that nature, it's always good to have some wiggle room in the financials if we want to go out and utilize that capital for something. Additionally, the rate's great. I mean, for a 6.5% interest rate, the amount of money we can borrow and pay back very quickly, kind of a sweet deal. Yes, sir.
And so that stabilizes our cash at all times then, right?
That's exactly right.
So we no longer have the cash on-hand concern.
Yeah, that's right. So if we didn't have the facility, we would have a cash constraint of that 702 until we got paid back. Instead, we just paid a little bit of interest, 2.2K of interest, and we never had that problem.
Okay.
So right now our cash accounts are sitting quite well, and I really hope to continue to grow them. That's my goal. Directing back here to the pro forma.
Sorry.
No, that's quite all right. We finished positive 92K roughly, despite the larger contractual obligations for the period. But again, I want to state that those contractual obligations are understated. And once we get kind of everything unwound and figured out, they will most likely increase unless there's misplaced periods in there. I don't think there are, but knowing what I found, it could go one way or the other. I don't want to opine on that quite yet. So I feel really good about the financial health of the organization and the financial structure. So those are two separate things, right? Your financial health is whether or not you can meet your obligations on a short-term and long-term basis. And our structure is how we're meeting those obligations. So prior to me, we didn't have a credit facility. We didn't have this revolver going in and out. And that really frees up our capital in the short term and long term as we think about our obligations, not only with gap payments, but if we want any growth initiatives, or if anyone here needs anything with respect to equipment and stuff like that. So it makes me feel like we're in a very good spot. We want to flip over to the pro forma balance sheet cash flow statement. I can give you a quick walkthrough. So we actually had a decrease in cash and cash equivalents of 508K. A lot of that kind of ties back to the fact that we, for the longest time, did not have all of our AP within our system. So we had a lot of accounts payable outstanding. We knew about it, but they never kind of made it into the system. So to understand the order of magnitude of the impact of those statements, we had no idea. So over the past month in December, Emma and I totally updated and revamped the Sage system to show exactly what AP we had outstanding. And so it gave us a better picture of what our obligations truly were in the short run. So when I say short run, guys, I mean less than a year. Long term is a year plus. So that's exactly what happened there. And you'll note all the way in the back, you should have a check registered. You'll see kind of all the checks that went out, right? But I want to caveat that doesn't show ACH transfers. It just shows the checks. So in the future, what I'd like to do is give you a glimpse into the ACH transfers as well, so you can see true cash going out. And I owe Carrie a crosswalk between the cash that we come, actually this entire board, but I owe a crosswalk of the actual cash coming in from AR, accounts receivable, versus what we actually turned into cash in that same period from charges received in that period. So if you went to the doctor in December and they paid out in December, you should be able to see that cash flow hitting. And then right below that, you'll see the contractual adjustments. And then right below that, you'll see kind of your ending cash. And from that, and of course, I'd like to break out, to your point, that other revenue, right? I'd like to break that out as well and show sources. So that's a work in progress. I'm working right now with Albert over at our RCM, third-party RCM company. And I'm sure Trista, she just stepped out, but I'm sure she has a report that I can pull in Epic to give me a better view. As it sits right now, the way things are happening in Epic is that all your AR, as it's booked into revenue, is coming over in a batch statement. So it's just one number, and there's no way to unwind that number on our side after it hits Sage. So it has to be done in Epic. And I'm not quite sure how that's done in Epic, but I know Trissa knows. So we're definitely going to work closely together, and we have been, and she's been absolutely amazing with the RCM stuff as I try and tackle this mess here. To figure out exactly when those revenues are hitting, who's paying us, right? So for the payers, and how long is it taking them to pay us? So some of these payers might be paying us very quickly for certain things and not so quickly for others. And I want to drill down to figure that out and see how quickly we can get these other payers to pay just as fast. So that's where that sits. We had an increase in accounts receivable, which is totally normal for the period. We had a lot of activity this period. So I don't want you to be concerned about our AR increasing. A lot of that also was the fact that not a lot of those AR bills were put into the system, or AP bills, sorry, I'm getting turned around. Our increase in accounts receivable was due to the fact that we quite literally had a lot of activity. There wasn't as quick of a payment made during that period like I just described. And so essentially, if we give out or we sell services and we don't get the cash, that's going to increase your accounts receivable.
Plus
So
you're not taking contractual.
exactly. So right, but that's a totally separate issue in the sense that we still have the AR, but then the contractuals will come out on the back end. So regardless, though, AR is great. AR, it's an IOU. It's not quite cash, but it's a great thing to have. You always want that positive, so you know that you're eventually going to get cash and make money from that.
So how is Nova working? Are they getting our money in?
They're getting our money in. I think if you ask how well they're working, right? I think there's opportunities to improve that relationship, not only on the structural side within Weston County Health Services, but also how Inova interacts with Weston County Health Services, if that makes sense. And I think with partnering with Trissa and her team and figuring out the best ways to do that with them, I think we're going to make considerable strides. I don't want to say my patience is wearing thin, but I'm closely watching, if that helps. I want to be very clear on.
So one of the reasons why I asked Paul for the reports that I did was so that we could evaluate Innova's performance. So looking at things from a high level like this is hard to evaluate their piece of the pie. So we're going to work on getting some more data in a different form that we can use to. That was one of the things that we discussed in finance that was very important, is that we keep an eye on them and judge their performance and judge it fairly.
Right. Correct. And so if you ask Inova, they will tell you that they were hired to do a high level overview of Weston County Health Services and then kind of got thrusted into doing all of our RCM processes.
So they didn't want to do it to start with? Is that what they're saying?
That's not the messaging that I received. Maybe it was like an unexpected change in a short period of
We
time.
didn't expect to get the whole bulk of it that fast.
Right.
So they were going to ramp up, and instead of ramping up, they just had to hit the gas.
Yeah, they kind of hit the cliff and dove right in. And so from that perspective, I do give them a little bit of an allowance with respect to a ramp up period. We're in month 3 at this point, and so I'd like to see a little more productivity. But again, it's not all their fault. It's not all our fault. It's definitely a collaborative team effort, and it's something that Trissa and I are ironing out as we speak. Trissa has taken the lead with respect to the RCM as I try and figure out these financials and right the ship here. And she has been a tremendous help as we continue to do that with Inova. Yes, sir.
I'd like to note on the balance sheet. So one of the things we were seeing before is that month to month, we were all over the place previously in the financials. And it's pretty remarkable from October, November, December, how steady our balance sheet now is. I mean, it's within a few $100 month to month. And that's shown pretty good progress on the financial reporting. So I appreciate that very much.
Thank you, sir. Yeah, it's been a slog. I'll be honest with the team here. It's been a slog. A lot of like, but we're finally in a spot where I feel like we're going to make rapid progress to a normalized, complete financial system. And so a lot of that at the finance meeting, Ted made the analogy of, when you go into your garage and set something down, it stays there until you clean it up, right? So your garage maybe gets cluttered. And in the same vein, that's exactly what happens in financials. You just kind of put things in there and then not allocate them to the proper period or the proper GL. They kind of just sit there and it looks wonky. And so we spend the past, 50 days. I just want to be clear on this. 51 days it took myself and David to reconcile 2.5 years of financials. And so I'm proud to report to this board.
Thank you for doing that.
Not a problem. That's why you guys hired me.
And if I may make a comment, it'll take me a lot longer than that.
And I'm getting ahead of myself here because I have it on the next page, but I think this is a perfect time to mention this. I'm proud to report that we actually submitted our FY24 and FY25 financial figures to the auditors.
Oh.
And so in 8 weeks from now, we will receive, or we expect to receive, the fully completed audit packet that we will then submit to the state. So not quite mission accomplished yet, but man, are we on the right direction.
Good.
So we're shooting the right azimuth, as some would say.
Yes.
And so back to the balance sheet here really quick. the increase in current liabilities, that's totally normal for the activity that we had for this period. Some of that is going to be the AP that we kind of left off the balance sheet from the previous administration till now. However, some of that is stuff that we incurred during the period. Again, we did over 2 million top line this period, so that's to be expected, right? It's not something to worry about or anything like that. If it was like, 2.2 million, I'd expect some questions, but right now it's sitting pretty well. As we see that, I'll keep an eye on it with respect to what we owe in the past. There are vendors that are calling, asking questions. I'm negotiating with vendors on a daily basis. I paid a lot out in AP in December, paid well over $1 million, not including the $702K that I spent here for the gap payment, but I paid out well over $1 million to catch up payments essentially and make sure that we stay on the good side.
So does it feel like we're caught up?
We're mostly covered. There's a few things. So one of the big ticket items was Blue Cross Blue Shield. And between when I took over and now, we've paid $191,443 to catch up to Blue Cross Blue Shield. Our go forward plan was well over $400K. Our go forward plan right now is to always true up payments on a bi-weekly basis to Blue Cross Blue Shield because that's when we incur, and then also pay back some of the outstanding invoices that we have. So kind of a leapfrog effect. We're not incurring due debt per se, but we're also extinguishing the old debt. So that's high on the radar. Outside of that, there isn't really too many big ticket items, there's nothing in the millions, nothing like that. Couple $100K. If we had to, gun to head, I can extinguish this all today with our current cash balance. So I don't want to do that. I don't think that's financially responsible for the hospital, but I do think that we should continue to leapfrog payments and make sure that we're caught up. My goal is by the end of the FY to be like totally caught up and really have a 30 to 60 day AP balance. So I don't want anything 90 to 120. It just doesn't look great. 30 to 60 days is perfectly fine. We do have higher balances with respect to travelers. And if you look at you don't have to do this right now, but when you get home tonight, you're thumbing through. If you look at the Manor, this is a really cogent point. If you look at the Manor's P&L, the profit and loss statement, you will see that it shows that we're profitable for the month. And this is why I love the balance sheet and the cash flow statement, because the P&L can be totally misleading, right? So it shows that we're profitable for the month of December, but the truth is that we're capitalizing all the labor costs from these travelers onto the balance sheet. And so that's not going to show on your P&L if you don't expense it out, because we're not paying them. The reason why we're not paying them is
Going under liability.
that's right, accounts payable, yes, ma'am. Our current liability, so paid within the year. The reason why we're doing that, though, and I would love to talk more about this in executive session, but there's some concerns with respect to the relationships we have there and the kind of people that we are receiving and the behavior of those people. And so those are all negotiation points, right? Why should we have to pay for poor performance, people walking off the job, so on and so forth. And again, I'm happy to talk more about that in executive session. Yes, ma'am.
So, and this was before your time, but why wasn't all of AP put in one pot then? Why is there
that lag?
Yeah.
I don't have an answer other than it was not done. It was just not. They had them. They had the information. We were paying two people to do it. It wasn't done. And I think we've had other separate conversations about that.
Mm-hmm.
Unfortunately, that sways the financial statements in a material way in which lends itself to not being honest with the performance of the organization. Good, bad, or indifferent, you should always expect your CFO to be honest with you and deliver you the news.